Thank you. Yes, we will say some words about cognitive medicine. I'm Anders Wallin.
And okay, I use this. I'm Wallin Terzis, and have worked with persons with cognitive impairment since 30 years, especially elderly with dementia, and I've done so both as a researcher affiliated to Karolinska Institute, but also as a neuropsychologist in a memory clinic. And both Professor Wallin and I are involved in the Swedish Association of Cognitive Medicine and would like to present for you the work of the association in highlighting the need for an emerging field of knowledge, and that is cognitive medicine.
But Beata, is cognitive medicine really a new approach? Do we not deal with these issues already in the existing fields? That is a question I have to ask you. Mm-hmm. Anyway, before we discuss these things, I would like that you to hear about cognition. What is cognition? Could you tell us more about cognition?
Yes, of course. As a neuropsychologist, this is really my goal, my focus of my work. And cognition is, as you know, a summary term for information processing. And this concept tells us about how the brain interprets, processes the information processing, and how we then use this information in our daily lives when we interact with other peoples or the surrounding environment. And this is an ongoing process during the whole life. And a lot of research has been done on this information processing and the underlying mental processes that are involved in this information processing. And cognition is often described as a system of 6 key domains that in turn are divided into different subdomains. And the different key domains are speed and attention, memory and learning, visuospatial functioning, language, of course, executive functions, and social cognition. And social cognition can be, in fact, is a result of the others. And when this information processing is taking place, it's engage the brain in a specific order. First, of course, you have the information is obtained by the sensory system, and then it's selected, the information is selected for further processing with the support of attention. Then different working memory system helps you to retrieve the information for shorter or longer time. And then, of course, long-term memory systems help you to retain it for a longer time periods, weeks, years. And this is exactly what's happening here in the room. We are giving you this information. Your brains are processing it. So you need your sensory system first. You hear us, you see us, you pay attention, we hope, to some of the things we say. And then with the help of your working memory system, you can have it in conscious. And then some details, not all, will, with the help of long-time memory system, be consolidated. So tonight or tomorrow, you can bring it back as a memory. Then we have language, and our verbal ability allows us to express and comprehend symbolic representations. And visuospatial functions help us to understand visual representations and spatial relationship in time and space. And for example, my visuospatial ability helps me so I will not fall off the scene, because I can judge how much is it left. Executive function, broadly defined, is a comprehensive concept for including all the necessary functions we need when planning, problem solving, and making decisions. And it's include initiation, goal-directed orientated actions for task, both complex and also basic. And this is our most complex cognitive function, and it depends on all the other more basic ones. And the consequence of an impaired executive function is, of course, difficult to plan and organize, but it's also expressed as impaired judgment, poor insight, and poor impulse control. So now it's driving on social cognition here. So you see the connection. And this executive dysfunction, I can tell you as a neuropsychologist, is extremely hard to measure. If it's very early and very subtle, I can't find it. If I give a test, a neuropsychological test for executive dysfunction, I can't say it. The patient will do perfectly well on the test, but then when he or she is coming home and they are in this more complex environment, they understand that they have problems. So this is very hard. So obviously, impairment in cognitive functioning has an impact on various types of activities in our life. And it can be planning our day, or accomplishing tasks at home or at work, or planning, for example, a talk to a conference in Thessaloniki, or cleaning the house. And it's also about managing personal economic matters, communication with others, or participating in a leisure activity. If I want to go to my tennis lessons, I must have all the toolbox with its cognitive functions. I must remember what date, what time I have the lesson, where is it, and maybe I have this reminder in my mobile, then I must use my language skills. I must read it, understand and comprehend this information. Then, of course, if I don't find my way, I must ask, communicate with others, and then the whole executive toolbox also. I must plan the whole activity. What things should I bring with me? Is my tennis racket? Is it the right clothes? How much time have I to go there if it's the rush hour? So in summary, cognitive impairments are clearly linked to disability. And cognitive impairment, it's not about memory disability. It's all of this function that I mentioned from the 6 domains that are affected. So I know that I have talked to Anders a lot of times and said, why is it called memory disorders? Why is it called memory clinics, right? So this is more than just memory. And cognitive impairment also has a profound effect of handling stress. And this is a catch-22, because when we are cognitively impaired, we can't handle stress. And when we are stressed, we are more cognitively impaired. So it's really a catch-22. And cognitive impairment has for many years also been associated with dementia diseases. And Alzheimer's disease, for example, as you know, is the most studied cognitive disorder. But Anders, cognitive decline is a major symptom, in many other groups of diseases. Can you tell us something more about that?
Yes, thank you. I will do that. And cognitive impairment, if we look upon it closely, it is common in a wide spectrum of medical conditions, not only in Alzheimer's disease. Is it part of inherited and early diseases of various types? And then we have all these neurodegenerative and vascular diseases. Alzheimer's disease is one of them, but you have other diseases too, Parkinson and Huntington's, and a lot of vascular diseases as well. So it's a wide spectrum of diseases, but not only in these core disorders. Cognitive impairment also take place in neurological and systemic, these various other neurological diseases, and also systemic diseases, heart insufficiency, for instance, tumors, and also trauma. So it's in a wide spectrum of disorders, and also in the various psychiatric disorders, depression, bipolar disorder, schizophrenia is the most important symptoms probably are the cognitive symptoms, executive dysfunction, apathy, and such type of symptomatology compromise behavior of certain people with schizophrenia, and also stress-related disorders. Stress-related disorders is not a question of being tired, it's a question of not knowing how to attend and how to do things to handle practical issues. So new research clearly demonstrates that stress-related disorders are cognitive disorders.
Okay, and recent study also indicates that several negative lifestyle factors can contribute to the development of cognitive disorders. And what are the most important findings there?
Yes, cognitive impairment is associated with lifestyle factors. For instance, sedentary lifestyle, also isolation, lack of mental activities and mental stimulation are important factors, as we know, and also unhealthy eating. So high calorie food is also associated with cognitive impairment. And these various epidemiologic studies have demonstrated that these negative lifestyle factors in the middle age are associated with cognitive impairment later in life. And also if you measure these factors in adolescents, you find that those people with negative factors, they have a higher risk of getting cognitive impairment life, and also in the middle age. So how to handle these things? All these epidemiological factors are important, but you can't get proper information. You can't use the epidemiological data to give advice to a person you meet in your clinic. But for the next generation, you could perhaps arrange the society in a better way. On the other hand, you have done some interventional studies. You need to do interventional studies to find out if lifestyle changes of lifestyle factors are efficacious. You have to do randomized controlled trials. And there have been some studies focusing on sedentary lifestyle, physical activities, or other specific lifestyle factors, but the data are not so promising, not yet at least. There have been some multi-domain interventions that are positive, but some are negative as well. So I think a big challenge for us today are to do really good studies in lifestyle intervention, to know more specific how to deal with these things in patients. So this is the status of the art for lifestyle factors as far as I understand it. You have perhaps other opinions. Lifestyle factors and societal issues are closely related. Beata, what are the challenges of the society of today related to cognitive factors?
Yes, I think the challenges of today's society calls for more knowledge about how to maintain all aspects of cognitive health, of course, in order to avoid disability. And for sure in Sweden, and I'm also here in Greece, the scenario is that we have a longer work life and need for skill development. And due to this rapid technology and global competition had led to an increased demand on the individual to sustain a high cognitive performance. And then we have another challenge, the number of elderly individuals, and with that, the prevalence of cognitive impairment. So that's another challenge. And I think that this work-related issue is very important because in an urgent matter in today's online society is reduced working performance due to a mismatch between cognitive demands and cognitive functions. And this is a growing challenge for many workplaces. I'm talking about adaptation to changing cognitive demands is necessary, and cognitive flexibility is even more important. And I think that we just have just began to understand the cognitive impairments that are associated with work-related stress. This is a very big issue in Sweden. And it's important to also understand how to prevent and to treat these problems. And all of these challenges are, of course, have a clear impact on health economic. And so, Anders, with all these arguments, I just wonder if there a need for this more knowledge about this field, cognitive medicine. Have we presented enough arguments?
Yeah, well, thank you for that question. And here is a sort of summary slide of what we have already talked about. If you start at the top, you see that there's a wide range of diseases, irrespective of the age of the patients, cognitive impairment, all these cognitive domains, decline in various cognitive domains are common in various diseases throughout the lifetime. And also, I mean, there are, of course, different expressions of cognitive impairment depending on the culture you live in and various social context. And this is a big research area to find out more about. But perhaps the most important thing to implement knowledge, already known knowledge, is to know how to identify cognitive impairment. And Beata has tried to explain what it is about. And there are methods. You could ask questions in a skillful way. You could do certain testing to screen for cognitive impairment. It is as important as measuring, as we believe, high blood pressure and other similar physiological parameters. So identification of cognitive impairment is really important to be able to handle it, to be able to prevent it, to be able to have various technological or interventional approaches. And the final pathway, of course, is to prevent disability, because this is a major cause of disability. Various physical diseases do not give rise to disability as evident in that big manner, in that pronounced manner as cognitive impairment, irrespective of the underlying disease. So this is we argue in favor of the notion that this is an emerging field of knowledge, but we already today have data that we could be implement in various settings. And it is also a new research area. As you know, we have done a lot of attempt to tackle Alzheimer's disease, but not yet without, we have no success concerning pharmacological treatment. We have known a lot of biology and various things, and we know a lot about the AD, but perhaps we should do more comparative studies with other diseases to find out more about AD pathology. And vascular factors, I will talk about vascular factors after this lesson, after this presentation. Vascular factors are also important. Perhaps one of the major factors that give rise to a cognitive impairment that could be modified. You could perhaps intervene already now. So this is a new research area. And also, I think to be very efficacious in this field, we need to identify cognitive medicine as a new clinical discipline. Now the knowledge is spread out in various specialities like geriatric medicine, psychiatry, neurology, and also in other fields. So we have to put it together to be more able to improve these situations which we are talking about now. So I think cognitive medicine is a new clinical discipline.
Okay, so in summary, myself and Professor Wallin and the Swedish Association of Cognitive Medicine, we are, of course, convinced that this is an emerging field of knowledge. And we also hope that we have with this presentation that we have broadened and succeeded your concept of cognitive impairment. So thank you for listening. And if you have any questions, we will be happy to answer.
Yeah, we have also written a paper, a position paper. If you are interested in the field, please read this paper and give comments how to develop this field.